Dr. Chris Jatana, professor, otolaryngology, head neck surgery at Nationwide Children's and Ohio State University. One of the most important findings in the study is we confirm that the esophageal protective features of a titanium-based battery technology does work compared to traditional coin cell batteries. There is a substantial reduction in injury in our esophageal tissue model at both 1 hour and also at 24 hours of exposure time. And this is going to reduce the severe esophageal injuries and deaths in many children who accidentally ingest these batteries based on our current evidence. The other aspect of this is understanding the role of our current protocols in the context of this new technology on the market and in homes going forward. And we know that button cell batteries or coin cell batteries essentially are a medical emergency when lodged in the esophagus. Traditional coin cell batteries essentially conduct current through the wet esophageal tissue, and that essentially breaks down into a highly alkaline or hydroxide type compound that just essentially dissolves away tissue very rapidly. And so when we have traditional batteries like that that cause severe injury very rapidly, uh, we do different things to try to slow that rate of injury. And when we slow that rate of injury by neutralizing that sort of basic or alkaline substrate, we use things like honey, for example, or sucralfate, and those help to neutralize that production and slow that rate of injury. And I think one of the things that we confirmed is that these types of mitigation strategies that are part of our National Capital Poison Center management guidelines should still be followed. And using those current protocols does not take away from the safety mechanism of the titanium-based lithium coin cell battery to protect the esophagus against severe injury. And we also validated that the diagnosis on X-ray is also the same in these esophageal protective batteries as far as looking for a double ring or halo sign on X-ray when healthcare professional zooms into the object on an X-ray. So we had several important findings that healthcare professionals really should continue to do what we're doing, but also know that this is on shelves and on the market, and this new technology will save a lot of children who accidentally ingest these from severe injury and death, based on the findings in our study so far. Great question. So, based on our findings in the study, we know that the diagnosis is still going to be the same based on X-ray findings. We know that there still is hydroxide formation at the tissue level, even with the protective batteries, although it is significantly less based on our observations compared to a traditional coin cell battery. And that being said, it's also an obstruction in the esophagus, and we know that this is something that should still be removed emergently. So, the diagnosis and management based on our current treatment protocols should not change for those healthcare professionals that are in urgent cares, emergency departments, or pediatricians' offices. This is based on research that we've done in the past, and I've, knowing that this is an emergency where the clock is ticking from the moment a battery is stuck in the esophagus of a child, as far as just causing injury. What is a first aid solution that parents and caregivers can consider if they suspect or witness a child swallow one of these batteries? And we tested a lot of compounds that are commonly found in household settings that are weakly acidic and also taste good from a palatability standpoint, and also are slightly viscous and can potentially help coat that area of the esophagus where the battery is. And we ultimately found that honey works very well at accomplishing that. And our current guidelines from the National Capital Poison Center recommend 2 teaspoons or 10 milliliters of honey every 10 minutes, essentially, for suspected or witnessed ingestions in the home until that child can get to an emergency department and get an X-ray to confirm the location of the battery. Sometimes they can pass, and sometimes they do become lodged in the esophagus. And it's the ones that get lodged in the esophagus that are at greatest risk for having, severe injury and complications. The sucralfate works similarly. It's a medicinal compound that's FDA approved for ulcers and other indications outside of this, but this is an off-label use of sucralfate. Based on our research, we showed that it was equally effective to honey at accomplishing the same thing to help mitigate and slow that rate of injury from a battery in an esophageal tissue model. Now, that helps to mitigate injury, until that child can get to the operating room and the battery can be removed. However, we know that when hydroxide is produced, that tissue can continue to break down over time, and so doing a sterile 1/4% acetic acid irrigation by the endoscopist who is doing the procedure can help to neutralize some of that highly alkaline material substrate that's essentially at the esophageal tissue level. And we've published our results in a case series on improved visual appearance and being able to safely perform these irrigations without any evidence of thermal injury or other complications. And that's the thought behind why we want to neutralize before and after to try to reduce that tissue from having a higher likelihood of breaking down over time. And we know that this battery, even though this new esophageal protective battery it's produced by Energizer. It's called the Ultimate Child Shield. It still does produce some hydroxide. It definitely has less voltage drop than the traditional batteries as well. And knowing this, we know that the protocols that we have to neutralize before and after removal should still be employed until we have data to suggest otherwise. And we really need to continue to collect data on ingestions of these new protective lithium coin cell batteries and real patient outcomes and the significance of this will hopefully drive other manufacturers to adopt a similar titanium-based technology that can either meet or exceed the new bar that Energizer has set.